This presentation will cover the definition of cannabis use disorder, the statistics that describe the population being disproportionately affected, the genetic and physical consequences, and potential treatment plans. Cannabis use disorder or marijuana use disorder is a clinical dependency that occurs when someone continues to use cannabis despite negative impacts on their physical and mental well-being. According to the Substance Abuse and Mental Health Services Administration, approximately 1 in 10 people who use marijuana will become addicted. When they start before age 18, the rate of addiction rises to 1 in 6. The National Survey on Drug Use in Health states an average of 23.1% of adults age 18 or older and 11% of adolescents aged 12 to 17 used marijuana in the past year. Cannabis use disorder is classified in the spectrum of mild, moderate, or severe. It affects the brain's mesolimbic system, the system responsible for the pleasure and reward system. Some cannabis-based products also contain many of the same harmful chemicals found in tobacco smoke, including tar, fine particulate matter, and carcinogenic compounds. Repeated inhalation can lead to chronic bronchial irritation and long-term lung damage. CUD also affects brain health, as it can knock down as much as 8 IQ points permanently from your brain health if consumed before the age of 18. CUD is also linked to a decrease in athletic performance, situational awareness, and fetal development. An article created by UC San Diego highlighted scientific research on heritable nucleotide polymorphism, more commonly known as single nucleotide polymorphisms, SNPs. SNPs are described as small variations in the genome and are found in between genes. Unfortunately, people that experience cannabis use disorder have a 30% chance of having a negative effect on their genome. It increases susceptibility to lung cancer in some individuals exposed to inhaled carcinogens. In other words, some people may be genetically predisposed to higher cancer risk when exposed to smoke, including cannabis smoke, whether it be directly inhaling or receiving it secondhand. Understanding this connection is especially important for communities already facing health disparities, limited access to care, or lower awareness of genetic risk factors. Education empowers informed choices. If you or someone you know uses cannabis regularly, it is important to recognize signs of cannabis use disorder, such as cravings, difficulty cutting back, or continuing use despite health concerns. Help is available, and therapeutic treatment is effective. Talking to a healthcare provider can make a difference. They can help assess risk, discuss safer alternatives, and offer support for reducing or stopping use if needed.